Hi, this is Frank with a Frank Opinion. This is kind of part two of the Financing Medicare for All information that I've been trying to give you. When Bernie Sanders came out with his bill, he also introduced a paper called Options for Financing Medicare. There are about 10 to 12 different financing options. And the first one was actually this one, a 7.5 employer payroll tax excluding the first 2 million in payroll. So we're not talking small companies, tiny companies, no, we're talking fairly substantial companies, medium-sized companies, and that this payroll tax would apply to both government and private employers. I confirmed that yesterday with Sanders' office. There would be, among other things, huge savings for states. Example, state worker, and I have the W-2 here of someone that was nice enough to give me their W-2. The salary, fairly healthy, $128,164. The health benefits paid by state government, $28,953. That comes under item number DD, that's the code. What is the percent of her salary going towards insurance? 22.59%. If the employer, state government, was under a 7.5 payroll tax, they would have been paid $9,612 towards that individual's insurance. What would have been the savings just on that one employee alone? $19,341. The $28,953, which they paid 2019, minus what they might have paid if we had a 7.5% payroll tax applicable to both government and private employers, $9,612, savings of $19,341. Now, why does this happen? And this is where I have my, actually it only used to happen 3 times a day. It's now up to 7 Luis Black moments, in Spanish, Luis Negro momentos, where I go bananas thinking, why are we doing this? Why are Americans doing this? That's because your tax dollars are going to private insurance companies. This is basically, let me give you an example here. This is like taking my wallet, okay, taking out the money and throwing it away. Yes, we're giving that extra $19,000 to, in this case, United Health, the specific subsidiary United Healthcare under the United Health Group. In 2018, the CEO was paid $20 million in compensation. Actually, it's more than that. By the way, in 2017, he got $83 million. A portion of that, a very large portion, was on selling his stock options. That was over $50,000. Versus the 2018 salary of the administrator for the Center of Medicare and Medicaid Services, around $200,000. Actually, Ms. Seema Verma was probably making around $180,000. So let's recap what we've been talking about here. The 2 first options for funding Medicare for All: a 4% employee health tax on net taxable income. That's after you take your standard deduction. And by the way, if you come down after the standard deduction to $29,000 less, you pay 0. That would have given us $350 billion according to the Sanders paper's analysis and estimation. The 7.5 payroll tax that we already talked about, his staff figured $390 billion. You add that up, you get $740 billion, just on those 2 taxes alone. What does that provide? It provides 70 to 96% of the revenue needed according to the 3 latest exhaustive studies on the revenue needed to provide comprehensive birth-to-death insurance, healthcare insurance, for all residents in the United States. That would include dental, medical, hospitalization, hearing, vision, long-term care, rehabilitation, mental health, etc. 3 exhaustive studies. As I indicated in the prior video, over 90 studies going back to 1990 basically say that single payer is the way to go. So I'm thinking to myself, why, when I have this Luis Negro momento, why don't Americans get this? Why don't our legislators get this? Certainly my congressman, which I've been talking about ad infinitum, doesn't get it. Maybe it's because, famous line from A Few Good Men, spoken by Jack Nicholson, you can't handle the truth. Whether it be climate change, Medicare for all, tax reform, the fact that almost everything is going to the 1% over the last 40 years, you can't handle the truth. I hope that in the future, that's not the case. And we begin to say, or can we? Can we begin to handle the truth? Medicare for all is absolutely doable. Thanks.